64-year-old Scott Phillips retired 3 years ago after a career in federal security. He and his wife Cheryl have lived in this Jacksonville house for 26 years. They thought retirement would be different.
We're all one happenstance away from living on the street.
Last year, Scott needed a prescription refill for blood pressure medication. Too young for Medicare, he enrolled in an Affordable Care Act health plan, $40 a month. Then he woke up with an infection that had to be treated in the hospital.
I got on that plan, it was like $40 a month. And then boom, woke up one morning, had what turned out to be an infection that obsessed, and went to the hospital, and $9,000 out of pocket. So that's now $100 a month that I paid the hospital for that.
Scott and his wife Cheryl live on $3,000 a month from Social Security. If he has another medical emergency this year, he'll face another big out-of-pocket payment that insurance companies call a deductible.
I've got the plan again this year, and it's going to be $10,000 out of pocket if I go. So I'll just have to go and, another $100 a month till it's paid off.
So you're getting in debt just to pay for your medical bills?
Yeah, the debt's there, but it's medical debt. Hospital takes a payment. They call every month and want to discuss something else, but I pay them $100 a month till it's paid off.
Cheryl is still recovering from shoulder surgery, her arm in a brace. She needs physical therapy twice a week. She also has a chronic illness that requires expensive medication.
She just had rotator cuff surgery, so the PT is 2 times a week, and that's $70 a week that's not covered. So that's been an added to the expense here recently.
When I ask Scott how close he is to the edge, his answer is stark.
It's like, I got a little bit of reserve, but there's no bank of dad anymore. There's no no friends that are helpful that have the money to support out there. It's kind of like it's either gonna, if it happens, it's gonna happen, and then I have to figure out how I'm gonna do it.
Now, what sacrifices are you making to be able to cover your medical expenses?
I like to cook a prime rib, and I went to the store the other day, and they had some prime rib out, and I was like, oh yeah, and I was like, oh, it's $91, $75. I was like, I found one for $41. So I did it. You get to the store, do I want this? But if I do that, then we're gonna go a couple of days where it's gonna be probably a PBJ instead of chicken or pork chops type thing.
PBJ, peanut butter and jelly sandwiches.
Why do you call it the Unaffordable Health Care Act?
Didn't plan for a $9,000 bill. Didn't plan for medications to continue to increase monthly.
What do you think needs to change in the U.S. to make getting older a more attractive part of life?
I just think that politicians and drug companies and they need to just do something instead of continuing to blow smoke. It's basically the medical industry, the pharmaceutical industry, all they want to do is make money.
At the end of our interview, Scott's wife Cheryl came outside. She had something to say.
Something's got to be done with this insurance because it's just not right, especially for us senior citizens. We paid our dues. We worked our fannies off. They need a break. We need a break. It's our turn. It's our turn.
Nitza, Soledad, Perez, CGTN, Jacksonville, Florida.